just want to appreciate, as I put scissors to this, cut the ribbon, symbolizing the opening. I just want to firstly appreciate the board and the management of Port Moresby General Hospital, and every one of you who are here, the angels that are saving lives. Thank you very much. Some in a civil service, they need 1,000 words to run one step. These people, just one word and they run 1,000 steps, 1,000 miles. So this partnership is better than so much impediment in our bureaucracy. I just want to appreciate this. I want to appreciate the health department for the support to Port Moresby. I look forward to this one, saving many, many more lives to come. Yeah. And it'll be unfair of me not to make this prevention better than cure. All Papuans out there. Rather you eat healthy diet. Don't go to rice and lentils. Go back to fish, cocoa, tapioca, taro. God has blessed us with this diet. I just want to ask all of you, please don't come here. But in any case, you just have to have something on standby for anyone. All right? Thank you very much. God bless. We just came to our 49th anniversary as a nation not too long ago. And when we arrived as government in 2019, for people like myself, knowing that my BMI was not appropriate, knowing very well as Prime Minister I have no excuse and I can't be medevaced also. I may easily be a candidate for this facility. I said, it does not look good for me to be medevaced and my people to die here. And so today I just want to say thank you very much for your support to make this happen. It is not fully completed as yet. At the end game, the end destination, we must have a full theater that ensures that the entire chain of process is complete. So anyone who comes in for investigation is able to be handled in all manners of procedures in one place in his own country instead of going outside. And so today to have over 1,327 patients treated here is for me satisfying. We saved this life. Most in a day and age where medical procedures are available to assist whether it's curable disease or non-curable disease. It is morally wrong to have absence of facility in our country and lives lost because facilities are not available. The burden of guilt is on those of us who have responsibility to create those facilities, yet lives are being lost. And what a wonderful investment. Just 40 million kina. I'm making reference using this word just. I don't loosely use all my words, so for those who follow me closely, all my words are specific. Just 40 million in the face of us earlier using so much million elsewhere. And we are able to save 1,327 lives, more so, maybe 800 or so, for those who were at that stage. And it's a stenting process. Many of them was able to establish what states they were at. And if the mathematics is that it's 100,000 per patient to go to Singapore or Philippines, then our country would have saved most of the family of those patients, because we don't have an insurance scheme, we don't have a system of support. So the family of these Papua New Guineans have saved 132,700,000. They have been okay in country, and they're being assisted, and now they're back at work. Non-curable diseases are especially prevalent amongst those who are the working class or economically productive citizens, because they have disposable income. So being least aware of what the intake of sugar can do to our body, the indulgence causes them to be overweight like me, and eventually seek people like Dr. Mok or Dr. Nam. So I'm happy we have these facilities now, and Kumul Kumul Petroleum has been asked to go all the way right through so that theatre is established. Not just a theatre for heart, maybe, but you have, you know how to design the facility. Port Moresby General Hospital, as our country's referral hospital, must have a state-of-the-art theatre for heart and for any procedure. So I leave it to all of you specialists to work that space. Our time, public servants, you have perpetual time. For politicians like me, I am time bound. 5 years, you never know, 18 months and I may be out of office again. Some people are saying second round is coming. God's choice and their choice. But when we still have life in us, let's secure the next phase where we go Kumul Petroleum and PMGH partner so that the theatre comes in. And every other thing that should enable us to have Port Moresby General Hospital as a fully national specialist hospital. The news that we have this facility has gone Pacific wide already. Even in Australia, they've heard that we now have when our cancer facility is open next year, it will be state-of-the-art, second to none. Second to none. We've jumped from having nothing, or basically operating a chemotherapy style facility, to now at the top of the range. So if you, layman's language, you're running an ordinary sedan, and you're now going to the Rolls Royce, so to speak. That transition has happened in our cancer facility. I'm happy that we got dialysis and kidney facilities coming up. Because saving of that life is ensuring that the talent in PNG is contained to contribute more to our country. So, PMGH and Kumul Partnership, I'm giving you full blessing now. We've invested all over the place with little return on investment. This one has absolute return on investment. So all of your Kumul staff and all of us at the PM department, my brother Jalta, we try to play golf every second day just to eliminate some fat. We're struggling to do that. And so any investment is worth it because it's life-saving on all of us. I've made a commitment to myself. I'll never be medevac. I'll never be medevac outside of this country. So for me, I know that I'm doing it for myself. God forbid it. But if it has happened, this is my facility I'm building. So I just want to encourage Kumul Petroleum to keep on the partnership space. After this, let's go to the theatre. Let's take out the cancer. Let's go to the dialysis machine. Our patients, our citizens don't have the affordability for expensive specialist care elsewhere in country or overseas. And government, any good government must deal with this for our people. So we intend to ensure that the fullest specialist services are available in our hospital here in Port Moresby, next hospital in Ley also. As soon as we get the staffing, we get the specialist people available, and the facility set up, then we migrate to Ley so that Ley could lift the burden of Port Moresby and look after the northern part of our country, and hopefully in time we are able to save lives here. So thank you very much. I am humbled that this moment in time is possible. No journey of 1,000 miles is achieved without the first baby steps. And for us, the baby steps took place. I want to acknowledge Dr. Noah and Dr. Papua. Of course, our senior says every time he sees me, he reminds me of it, even before I was the Prime Minister. But God bless your lovely wife as you rest. And there was one moment where Dr. Noah and Dr. Papua came, with no protocols. They just said, we wanted to see you. Early on in my time, we started Airways, and there was a moment in 2015 where I met Dr. Noah. I was passing through Singapore and he was working in Singapore General Hospital. Having known him since high school, he was my high school mate. So I asked him, why are you serving in Singapore? You should be back home. And he said, I do not have the facility to work back home. my skills would be wasted, so I'm saving here in Singapore. They have heart facilities here. And so Dr. Topo and Dr. Boko found me at Airways, and they basically said, there's no one else. You're the last man at the chain of command. You asked me to come back, Dr. No, I said, I'm back now. I need the workshop to work on. I need the facility. These two gentlemen impressed upon us. Picked a phone call, called him. My brother here, Minister, he may not be a doctor, but he loves the medical profession very well. Make it happen, and here we are. And, one step at a time, we'll get there. It's by 2025. Don't sleep. Work 24 hours. The theater must be ready by next year, please. Thank you so much.